Welcome back to Montana this morning. The time is 6:28. We have a Dr. Erica with St. Vincent Healthcare on the Zoom line this morning, and it's a great time to catch up with you because lots of kiddos are getting ready to head back to the classroom if they haven't already. But this year's factor, the Delta variant. Before we dive into that, let's take a look back at last year and what we were able to observe and kind of gather together as a result of the pandemic.
Last year at this time, it's interesting when you look back at some of the graphs, you see that we were starting to go up just like we are right now. And in some ways, we actually have some higher cases than we did last year at this time. But now we have the Delta variant, which is more severe, more infectious. It's easier to get infected if you are around somebody who has it. And we're headed into school again. Last year, was like, it was so new and, unknown there. And we really put out a lot of protection in terms of the spacing of kids in school and the hand hygiene rules and the masks as well. And the masks last year were mandated. Right now, School District 2 is making them optional, but highly recommending them. And when we look back at last year's numbers with COVID, we weren't seeing as many kids getting sick with COVID as we were adults. Now we're seeing more kids getting sick with this Delta variant COVID. But the interesting thing about last year was that in the hospitals and in the clinics, and we were not seeing the influenza and the RSV, which are both respiratory spread viral infections that usually fill up the hospitals, the ICUs, and keep the pediatricians busy all winter. And we didn't see any of that last year. And so it's felt to be because we did such a good job with these infection control measures to try to prevent infections in the first place.
And I did hear in national news recently that those RSV cases are going up in kids. Are we seeing that here yet with our local kids?
Exactly. We are seeing RSV here again, starting to trickle in. And what we're seeing nationwide with these really severe bad cases in kids with the Delta variant COVID, in a lot of them, they are co-infected with RSV. So RSV usually is not around this time of year, but because we did relax the masks and start intermingling and mixing a little bit more when it was summer and we were outdoors and more people were vaccinated, we are seeing RSV coming back late, I think it is. And so now we are having some kids in the hospital with RSV, and then the combination of RSV and COVID is a bad combination. So I think it just shows that we need to do everything we can to try to prevent all of these respiratory infections in our kids, especially as they go back to school next week.
Yeah.
Or if they're already there, like you said.
Yeah. So let's talk about that. What can we do as community members, as our kids, as students, to kind of enter with the best approach possible?
Yeah, I think, like you said, it's a community-based thing as well as a parent and teacher-based thing. And obviously, you've heard me say it a million times, is number one, vaccinate. So vaccinate everybody around your kids. Your 12 and under kid or your 11 and under kids are not able to get the vaccine yet, even if they wanted to. And so you really just have to vaccinate everybody around them so you kind of protect them in this cocoon of vaccination. And then when the boosters start coming available, when you're due for that, getting those. Also, we have influenza vaccines coming out this fall. We did a good job with those last year. I would do those again. So the vaccination is the number one thing of prevention for serious illness. It doesn't prevent illness entirely, but serious illness. And then number two are these infections control measures that we talked about earlier. I strongly, strongly encourage parents to get your kids in masks and wear masks all day long. They're not going to be perfect at it. They're little kids, and there are, but it's harmless, for the most part, with some very, rare exceptions. It's cheap, it's easy to do. And it has shown last year that we did decrease all these other infections that we don't want to see coming back out again. Remind them about the spacing, remind them about the hand hygiene, keep them home if they're sick at all. We were really good last year at, not sending kids to school, doped up on ibuprofen or Tylenol and cold medicine, spreading their germs to everyone else. So just be smart, be reasonable, be responsible. We got to keep these kids safe, keep getting vaccinated for our whole community so that we can not have a third Groundhog Day of Delta or another variant of COVID coming out again in the future.
Yeah, I just can't imagine just seeing your kid go through the common cold is tough enough. And so when they get something worse than that, that's, got to do everything you can to keep the kids safe, right?
Absolutely. Control what you can control.
All right, Dr. Erica, thank you so much. It was great seeing you, and we will see you again this time next month. Thank you so much.
Great.
Thank you. We'll be right back after this.